Hi everyone, I'm Mingming Xu. I'm one of the gastroenterologists at Kaiser West Los Angeles. So I'm here to talk to you today about the Endoflip catheter. This is something that we find very helpful in our GI lab specifically for essentially measurement of esophageal compliance for patients who are undergoing POEM, pre and post POEM. It's essentially, in my mind, a real-time way of getting esophageal manometry and the information that you would get from an esophageal manometry evaluation. So basically what you have here is a Endoflip catheter, which it's inside the pig specimen right now, but outside it kind of looks like this. It's essentially a balloon catheter that gets inserted across the GE junction, and it gets inflated to a certain degree. There are these electrodes down the length of this balloon that measures esophageal compliance once the balloon is inflated. And the information it gives you is very similar to what you would get from an esophageal manometry. In our patients who undergo POEM, we always do endoflip measurement pre-POEM and post-POEM in real time after the procedure to ensure that we achieved an adequate myotomy. And so the kind of information that you get from the endoflip is essentially demonstrated on this screen here. It measures the distensibility of the GE junction of the esophagus. You can see here that there's a high pressure zone, which is where the red markings are, and the distensibility measurement is in millimeters squared over millimeters of mercury. And for a normal kind of range would be anything kind of above 3.5. And then anything below that would suggest that there's a high pressure zone there. So for a lot of our pre-POEM patients, the sensibility is oftentimes like 1 or even less than 1 in patients who are really have severe achalasia and essentially a high pressure zone at the GE junction. And post-POEM, we're looking for a distensibility above 3 in terms of assessing an adequacy of our myotomy. The other measurements that the catheter gives you is the diameter, which is just the diameter of the GE junction. Again, in a lot of our pre-POEM patients, we see diameters of like 3 millimeters or less. And we're looking for something above 5 millimeters post-myotomy. So the catheter gives you kind of essentially real-time information about the compliance, the diameter of the esophagus at the GE junction. So it has a lot of value for assessment of achalasia patients during POEM procedures. There's also a version of the catheter called the Endoflip catheter, which is essentially meant for controlled balloon dilation of the esophagus, and it can achieve essentially the kind of dilation that we normally achieved with the much better than the pneumatic dilation. And it gives you kind of real-time assessment as well of the compliance and distensibility pre and post dilation.
Do you use Endoflip in other indications other than achalasia?
Yes.
GERD workup?
Right, so a lot of the esophageal surgeons, the foregut surgeons, have started using Endoflip pre and post their fundoplication, again to assess basically if the wrap is tight enough, if they've achieved the kind of tightening of the hiatal hernia and the esophagus pre and post fundoplication. There's also been some innovative kind of thoughts about using Endoflip across the pylorus to measure compliance of the pylorus for patients who undergo GPOEM, gastric POEM for gastroparesis. But most commonly, what we're using it for really is for patients with achalasia, pre-post POEM. That's what I've seen. But yeah, there's some other indications as well that are unique.